Do retail medical clinics threaten the doctor-patient relationship? Since 2000, retail clinics across the country have offered basic healthcare services, such as treatment for strep throat or routine immunizations. However, they continue to expand their services, and some are taking on management of chronic conditions. Over the years, physicians have expressed concern that these clinics impose on the doctor-patient relationship and make coordinating care more difficult. After a panel discussion by the Alliance for Health Reform, Dr. Rick Kellerman, a past president of the American Academy of Family Physicians, said that while some doctors have warmed up to the idea of retail clinics offering basic care, these clinics can't replace a primary care physician. The next challenge will be how retail clinics will fit into an evolving system of care delivery.
And as we go to larger integrated systems, as the payment system changes, the onset of accountable care organizations, that's going to change the environment and how we look at integrating retail clinics, urgent care clinics, the emergency room, and in particular continuing to put a focus on primary care practices. That's really where the change is going to be. So for a very defined population, a retail clinic might provide after-hours care, for example, but they are not a substitute for patient-centered medical care. They're not a substitute for a primary care physician.
Insurance representatives voiced support for retail clinics, saying that, among other things, they can help reduce unnecessary emergency department visits. Ativ Maroda, a policy analyst with the RAND Corporation, highlighted findings from a RAND study that said fewer than 40% of clinic customers have a regular primary care doctor. To compete with retail clinics, Dr. Kellerman pointed out that family physicians are extending their office hours, emailing with patients, and providing more same-day appointments. But fundamentally, the healthcare system needs more primary care physicians, and that means more of an investment in the primary care workforce. Here's Dr. Kellerman.
We've got to look at innovations of how we take care of people. But this also proves the importance of why we need policymakers to support primary care, we need the health insurers and the payers to support primary care, and we need the medical education system to change.
Reporting from Washington, this is Frances Correa.